Hello, my name is Souza, and on behalf of my colleagues, I would like to thank the ICS for the opportunity to present our study on the prevalence of lower urinary tract symptoms 6 months after hospitalization due to COVID-19. I have no disclosures. There have been some reports of lower urinary tract symptoms affecting patients in the acute phase of COVID-19, but the prevalence and the long-term outcomes of these symptoms are not yet known. Our primary aim with this study was to evaluate the prevalence of LUTS in men and women 6 months after hospitalization for the treatment of COVID. Our secondary goal was to evaluate the association of clinical parameters of COVID severity and comorbidities with the prevalence of LUTS in the long term. Brazil has been badly hit by COVID with more than 20 million confirmed cases. São Paulo, its biggest city, is one of the most densely populated cities from low and middle income countries. During the 2020 COVID outbreak, Hospital das Clínicas, which is our largest public-funded academic health center, undertook an operation that turned its main hospital into a fully dedicated inpatient facility for individuals presenting moderate to severe COVID. Over 3,500 inpatient admissions due to suspected SARS-CoV-2 infections took place from March through August 2020. In order to follow up on these patients and evaluate the post-acute sequelae of SARS-CoV-2 infection, a group of researchers funded the PASC initiative and developed a protocol for multidisciplinary prospective observational evaluation of a cohort of patients surviving hospitalization in São Paulo. Their total cohort was over 2,000 subjects. Since urology joined the team later than other groups, our cohort was 255 adult subjects, 138 men and 117 women. They all had laboratory confirmed COVID and had been treated as inpatients at Hospital das Clínicas in São Paulo. To evaluate the severity of COVID, we used the following parameters: the need for intensive care, orotracheal intubation, dialysis, and total length of stay. The pre-existing comorbidities we evaluated were hypertension, diabetes, obesity, chronic pulmonary obstructive disease, cardiovascular disease, and sleep apnea. Patients were asked to rate their own health status according to their own perception, as very good, good, moderate, bad, or very bad at the time of the 6-month evaluation. And LUTS were assessed using the International Prostate Symptom Score Questionnaire. The median age of our participants was 57.3 years. The most common comorbidities were diabetes, hypertension, and obesity. The median length of stay was 15 days, and 49% of the patients stayed longer than that. 70.9% needed intensive care, 46.7% needed intubation and mechanical ventilation, and 15.3% needed dialysis. At the 6-month evaluation, 53% of the patients considered their own health as moderate, bad, or very bad, and 47% considered it good or very good. Male and female patients were comparable in terms of age distribution, educational level, physical activity, general health status, comorbidities, and COVID severity parameters. A total of 89% of our participants had at least one specific symptom evaluated by the IPSS questionnaire. The most prevalent symptom was Nocturia, followed by increased urinary frequency and urgency. Only 11.6% of the men and 9.4% of the women were asymptomatic. Here we can see that 47% of the patients had mild symptoms, 36% had moderate symptoms, and 6% had severe symptoms. There was no significant difference between men and women when it came to the severity of lower urinary tract symptoms. The prevalence of moderate to severe LUTS was 42.4% overall. It increased with age and was similar between men and women. When we look at the answers to the last question on the IPSS questionnaire, we can see that LUTS had a significant impact on the quality of life of 44.5% of our participants, who were dissatisfied with their current urinary condition. On univariate and multivariate analysis, no COVID severity parameter was associated with a greater risk of having LUTS 6 months after hospitalization. On multivariate age-adjusted analysis, diabetes was the only comorbidity associated with a higher risk of having LUTS, with an odds ratio of 1.75. Having a self-perception of their own overall health as moderate bad or very bad, which we called a poor health status, was associated with a higher risk of LUTS, with an odds ratio of 3.12. Our study shows a high prevalence of LUTS among COVID-19 survivors 6 months after hospital discharge. When we compare our data to those of the EPI-LUTS study, which evaluated LUTS in the general population of the United States, the United Kingdom, and Sweden, we found that moderate symptoms were 44.4% more prevalent, and severe symptoms were 38.1% more prevalent among men after COVID, and for the women, moderate symptoms were 24.5% more prevalent, while severe symptoms were 58.1% more prevalent after COVID. Storage symptoms are the most common, especially nocturia and increased urinary frequency. Diabetes and a poor health status were associated with a higher risk of having moderate to severe LUTS, and clinical parameters of COVID severity were not associated with the risk of having LUTS. This was the first study to evaluate the prevalence and characteristics of LUTS in the long term following hospitalization for the treatment of COVID. We found that LUTS are highly prevalent and often bothersome among surviving men and women 6 months after their hospital discharge. Storage symptoms were the most frequent. Future studies should clarify the longer-term outcome of LUTS following COVID, and in fact we do plan on re-evaluating these patients at 12 to 18 months after their hospital discharge. A comprehensive assessment of LUTS and their effects may help ensure appropriate diagnosis and treatment for these patients. I would like to thank you very much for your attention and welcome any questions that you may have.